Hey there, are you trying to understand what is Medi-Cal and are you suitable for it? Well, I am actually looking up online right now and we can learn together. So Medi-Cal is California Medicaid program, and California Medi-Cal Assistance Program is the California implementations of the federal Medicaid program serving low-income individual, including family, senior, personnel with disability, child, and it's all disappeared because it's shown on the website. Anyway, so this is the program that support and provide access to Medi-Cal billing support services to perform secure Medi-Cal fee-for-service and other associated healthcare program claims and transactions. So you can sign up and learn more about that on their website, which is the mcwep.apps, and there's so much information. Also, Medi-Cal is a health insurance program for people with limited income. The Affordable Care Act, ACA, makes some helpful changes to Medi-Cal to make more people eligible. When you first qualify for Medi-Cal and receive your BIC, you are covered under the fee-for-service, also called regular Medi-Cal. Extending Medi-Cal to hundreds of thousands more is important steps to help close health equity gaps in the states and get us closer to universal coverage. So what do you think is the most effective way to help equity gaps in California? They also actually give the Q&A here for us to learn more, but let me actually go to the website DHCS, D for Danny, H for Henry, C for cat, S for service .ca california.gov. So we understand a little bit about what's going on right now. So on the website, it will show you Medi-Cal resources. Medi-Cal is California Medicaid program. This is a public health insurance program which provide needed health care services for low-income individuals, including families with children, senior, person with disability, foster care, pregnant women, and low-income people with specific disease such as tuberculosis, breast cancer, or HIV or AIDS. Medi-Cal is financed equally by the state and federal government. So they have resources for individual, county, and provider enrollment. So individual apply for Medi-Cal and get answer to frequently asked questions. So let's go into that right now. And also they have the benefits, long-term care reimbursement, and all the other informations. Way to apply for Medi-Cal. So below you will find ways to apply for Medi-Cal health coverage. Your choice to apply are by mail, in person, or online. For more information, look at the frequently asked questions. Step 2, Medi-Cal, a step-by-step guide to the Medi-Cal process. Tips to speed up your application health coverage. Apply for Medi-Cal. So you can do online. You can fill out the information with the applications they attach on the website, or you can do that in person by going there. They have the frequently asked questions here for you as well. So let's click on that. So what is Medi-Cal? Medi-Cal offers free or low-cost health coverage for California residents who meet eligibility requirements. Most applicants who apply through Coverage California and enroll in Medi-Cal will receive care through managed health plans. Medi-Cal has always covered low-income children, pregnant women, and families. On January 1st, 2024, California expanded Medi-Cal eligibility to include low-income adults. When you complete a Coverage California applications, your eligibility for Medi-Cal will automatically be determined. You can apply for Medi-Cal benefits regardless of sex, race, religions, color, national origin, sexual orientations, marital status, age, disability, or veteran status. How much does a Medi-Cal cost? For many individuals who enroll in Medi-Cal, there is no premium, no co-payment, no out-of-pocket costs. Effective July 1st, 2022, all monthly premiums were reduced to zero. In general, individuals in Medi-Cal will get the same health benefits available through Covered California at lower costs. What is the difference in coverage between Medi-Cal and Covered California? Medi-Cal is health coverage, just like the coverage offered through Covered California. Medi-Cal provides benefits similar to the coverage options available through Covered California, but often at lower or no cost to you or your family. At the health plans offered through Covered California or by Medi-Cal include the same comprehensive sets of benefits known as essential health benefits. Essential health benefit consists of outpatient ambulance services, emergency services, hospitalizations, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatments, prescription drugs, programs such as physical and occupational therapy, known as rehabilitative, habitative services and devices, laboratory services, preventive and wellness services, and chronic disease management. Children pediatric services include oral and vision care. Okay, a recent survey of Medi-Cal members by a California Healthcare Foundation, CHCF, found that 90% of respondents rate Medi-Cal as a good or very good program. Medi-Cal emphasizes prevention-oriented healthcare that promotes health and well-being and works to ensure members receive the right care at the right time. How is the state or counties reaching out to homeless population to sign them up for healthcare? Outreach and enrollment grants for targeted populations. Individuals who are homeless are one of the target population for $25 million, $12.5 million in the California Endowment Funds plus $12.5 million in federal funds for grants to counties under AB 82. Trailer bill language enables as a part of 2013-2014 budget. Department of Healthcare Services, DHCS, has released guidance to the counties about these funds and held a webinar to date with the goal distributing grants to county by February 1st, 2014. California Policy Academy to Reduce Chronic Homelessness Work Group. California is one of the 4 states that recently participated in the Federal Substance Abuse and Mental Health Services Administration's SAMHSA Policy Academy to Reduce Chronic Homelessness. With the expansions of Medi-Cal eligibility, many people who are experiencing chronic homelessness will be able to enroll in Medi-Cal. The Policy Academy state's team and consultant are currently engaging homelessness subject matter expert in the Medi-Cal outreach and enrollment work group to explore preparing toolkits of best practices for outreach and enrollment of the chronically homeless population that DHCS could then share with the outreach and enrollment grantees. This will build upon best practices from the Low Income Health Program, LIHP, as well as recent philanthropic funding's effort to enroll the chronically homeless populations. So what health plans are available through Medi-Cal? Medi-Cal Managed Care offers selections of 21 health plans. Your health plan's option will vary depending on the county in which you live. Most counties offer commercial plans, which also operate in Covered California, including FM Blue Cross, Kaiser, HealthNet, and Molina. Other plans are public plans administered by the community. Every county's Medi-Cal plans provide the same high-quality care at the same low cost or no cost to Californians, no matter where you live. The directory of health plans available through Medi-Cal Managed Care is available online. Medi-Cal Managed Care Health Plan Directory. Will I be able to stay with my doctor? More than 400 hospitals and approximately 100 30,000 doctors, pharmacists, dentists, and other healthcare providers participate in the Medi-Cal program to provide medically necessary services to members. Most Medi-Cal members who participated in the CHCF study said it's easy to find a primary care physician nearby. You can search for a managed care provider on Department of Healthcare Services website at Healthcare Options. It is possible for members of the same family to qualify for different coverage at the same time. The Covered California application is a single application for multiple health coverage program. It is common that members of the same family or tax households are eligible for different programs. For example, both parents could be eligible for tax credit through Covered California, while the children are eligible for Medi-Cal. This is because the eligibility rules for Medi-Cal kids are different than adults, which ensures that no kid lack affordable coverage. In other cases, one parent may be eligible for Covered California without subsidized because they have access to affordable coverage through their job, while their spouse is eligible for premium assistance tax credit through Covered California and the children are eligible for Medi-Cal. What do I do if I have questions about medication, accessing doctor or specialist? If you have questions about your coverage under Medi-Cal managed care, you can call your health plan's customer service representatives directly just as you would under any other health coverage plan to accept the Medi-Cal managed care health plan directory. You can block in the Medi-Cal managed care. Can I decline Medi-Cal and enroll in a Covered California health plan and receive the federal premium assistance? Under federal law, if you are currently enrolled in or are eligible for Medi-Cal, you are ineligible to purchase subsidized coverage through Covered California. If you are eligible to Medi-Cal, you can still purchase a health covered plan through Covered California, but you cannot receive premium assistance to reduce its cost and will have to pay the full cost of the Covered California healthcare plan premium. Is there a deadline to enroll in Medi-Cal? No, there is no deadline to enroll in Medi-Cal. You can apply at any time during the year. When you are determined eligible for Medi-Cal, your eligibility goes back to the month of your application. In some cases, you may be able to receive Medi-Cal coverage right away. Contact your county human services agency at county offices for more information. However, enrollment in Covered California only occurs during an open enrollment paper. So if you are trying to enroll some household member in Medi-Cal and others in Covered California, be ensured to enroll in time for the household seeking coverage through Covered California. If someone Medi-Cal's coverage is canceled due to increased income or decreased household size, does that person qualify for special enrollment into Covered California? Yes. Losing health coverage such that Medi-Cal is considered a qualifying event that would trigger a special enrollment period. Other qualifying events include permanently moved to within California, lost or will soon lose their health insurance including Medi-Cal eligibility, also known as loss of minimal essential coverage, MEC, had a baby or adopted a child, got married or entered into a domestic partnership. Domestic violence survivors, if married, abuser income not count if the survivor lives apart and is unable to file joint tax return, return from active duty military service, release from jail or prison, gain citizenship, lawful present, federal recognized American Indian, Alaska Native. Other qualifying events as identified on the Covered California portal. In the event that one of these live events does occur, you would be eligible to enroll within 60 days of that event. During that period, you could not be denied coverage by a health plan in Covered California or in the individual market if you are otherwise eligible, and you could be eligible for the premium assistance that is only available through Covered California. There's so more questions, but we getting there. My Medi-Cal has been discontinuing and I am now able to enroll in Coverage California during special enrollment period, SEP. How can I avoid a gap in my health coverage? In your Medi-Cal will be or has been discontinued. In order to avoid a gap in your health coverage, you should pick a Coverage California plan before the day of your Medi-Cal ends. If you do not select a Coverage California plan in the same month of your Medi-Cal ends, you will not have healthcare coverage for at least a month. You must also pay for your Coverage California premium by the due date when you are billed in order to be covered. If your request for enrollment is complete within 60 days of the qualifying life event date, the soonest your Coverage California health plan can start with will be the first of the month, followed by Coverage California plan selections. If you wait more than 60 days after your Medi-Cal ends to pick a Coverage California plan, you may not be able to enroll until Coverage California next open enrollment period. You might contact Coverage California online at coverca.com or call them 800-300-1506 or contact your county eligibility worker assistant in selecting your Coverage California plan. You may reach your county eligibility worker at County Social Services Agency. I previously was denied Medi-Cal due to owning a car. Do I qualify now? The Affordable Care Act simplified financially eligibility requirements for Medi-Cal program eligibility. Under these simplifications, property such as a car is no longer counted. You should apply through Coverage California for health coverage, even if you previously were determined to be ineligible for Medi-Cal coverage, and even though you might think your financial situation has not changed. If I sign up for Medi-Cal, will anything happen to my access? Medi-Cal only tries to recover costs for medical assistance after your death when a recipient is over age of 55, or when a member of any age is cared for at an institution such as a nursing home. Medi-Cal does not seek payment during your lifetime or lifetime of your surviving spouse, disabled son or daughter, or while your child is under 21 years old of age. If you are under 55, you can sign up for Medi-Cal knowing that nothing will happen to your access unless you are institutionalized. For those over age of 55 or in an institution, the Department of Health Care Services may present a claim for your cost of your care. It will be paid for your estate at the time of your death. For more information, please visit third-party liability. All right, seems like that's a lot of questions there, and also, they have different things for you to look into as well. And you can do that online or anywhere that you think is beneficial. I don't know much, but there are also different websites for you to check it out about their benefits. I believe it's called BenefitsCal, and let's look into that together. You can call them anytime and they will give you the information for this. The website called Benefits with an S, cal.com. For this, I don't think you need to have the login, but you can read more about the informations here. Welcome to BenefitsCal. Apply for benefits. So if you want to apply for the benefits, you can fill out and submit your applications, upload the documents, and they will review your applications, and also they will schedule the interview. This is a little bit something I don't really aware of, but like I said, I just only know about Medi-Cal.
Did you know that you can apply for benefits at BenefitsCal.com? That is BenefitsCal.com. To apply now, press 1. If you've recently applied for benefits, press 2. To hear these choices again, press 7. To go back to the last menu, press 8. sorry, I did not receive a response. To apply now, press 1. If you've recently... To apply for food assistance, press 1. To apply for health coverage, press 2. To apply... Please hold while we transfer your call to the next available worker. To help us improve our service, please stay on the line to take a short survey after speaking to a worker. All workers are currently assisting other customers. Please hold for the next available worker. Thank you for waiting. At the San Francisco Human Services Agency, our vision is a San Francisco where everyone has the opportunity and support to achieve their full potential through all stages of life. When you speak to our worker on the phone, please ask for whatever you need and ask any questions you have. It's almost time to renew your Medi-Cal coverage. You may need to take action to keep your coverage. Please respond as soon as possible to all requests for information from your local county office. It's almost time to renew your Medi-Cal coverage. If you receive a renewal packet or a letter asking for more information, you may submit the information by mail, phone, in person, or online.
Good afternoon. This is Charlene, Department of Human Services. How can I help you?
Hi, I would like to apply renew for the Medi-Cal, please.
Do you have a case number?
Yes. Well, that they gave it to me when I called someone earlier.
And what would you like to do for your Medi-Cal, ma'am?
Yeah, I would like to renew it, please.
Your Medi-Cal is active, ma'am.
Oh, okay. I would just want to make sure, how's that work? Guys, I never actually received the actual card, and I'm no longer living in San Francisco. Do I need to update the address?
Yes, we could update your address. Where do you live at, ma'am? Okay, ma'am, you're living in the county of Los Angeles. Did you think maybe if you wanted to have your case transferred there?
Yeah, so I was speaking to someone earlier and they said I need to call the San Francisco office in order to update it first or something like that. And then the office will take care of the county. So if I need to do something else, just let me know.
Yeah, your renewal for your Medi-Cal is until July of 2024.
It's end in 2024 of July?
July is when you do the reevaluation.
Oh, got it. May I know what is the benefits of the Medi-Cal?
It's just to, the Medi-Cal is for you to go to the doctor with. Any doctor, dentist, eye doctor, things like that.
Mm-hmm. Got it. I don't think I have the card with me ever, so I thought I didn't have a health insurance.
I could, let me see if I can order your card. Okay, ma'am, that card's been ordered for you.
Thank you. So they will ship it to the current address, right?
Yes, it's going to be mailed.
Got it. Will they also send...
Huh?
Will they also send the benefits in there or just the card by itself?
It's just a card. It's a Medi-Cal card.
Yeah, do you know where can I actually access more for information for about Medi-Cal?
You can go to the website. What information are you looking for now?
Yeah, just general, because I think I applied in 2022. It's been a long time, and I forgot what's the benefit, so I can actually go check up for health and everything, because I haven't done it for a long time, and I've been getting sick.
Hold on one moment, ma'am.
Thank you.
You could go to www.dhcs.ca.gov. Now, would you like to www.dhcs.ca.gov.
Got it. And what would you say?
And that way you can look up more information.
Okay. It's under Medi-Cal, right?
Yes.
I think it's like learn more about Medi-Cal's program.
I'm sorry, ma'am?
Is that under they saying learn more about Medi-Cal programs, right?
Yes, ma'am.
Okay. Also, what I saw on the website, I think benefits something California.
Cal,
Yes.
BenefitsCal.com.
Yes. They was also talk about supportive for food and the other things. Is that applicable for my situations?
You said for food?
Let me click on it.
You mean like Cal Fresh?
Yes. I think yeah.
Yes, but you would have to apply. You couldn't apply in San Francisco. You'd have to apply in that county now
Got it.
for Cal Fresh. Yeah.
Should I give them a call or
Yes. Do you have a number for the Los Angeles Social Services number?
no? Do I have
Need a
to?
number. Let me get.
So now my address updated. So it should be no problem to calling them to apply, right?
No.
Yeah. Can I have a number, please?
Give me one moment. I'm getting you the number now. Give me 1 second.
Thank you.
No problem. Area code 866 613 3777.
37.
77.
Okay, 77. Okay.
Uh-huh.
Yeah. I also see it's like you need to have it's like a status here in order to get qualified.
We're in Los Angeles.
Yeah, or in California in general.
I'm not quite sure about that county.
I see. How about San Francisco?
What about San Francisco? In order to get benefits in San Francisco, you have to be a resident of the county. So I don't know about Los Angeles. So.
Resident, okay. Got it. Okay, so that's the only number I should call them at the moment, correct?
Yeah, that's the number. Let me make sure. There's another. They have another one on Glen Oaks Boulevard, Shadow Hills, California. I don't know if that's LA. It says Los Angeles too. Would you like that number?
Yes, please.
It's 626-569-1399.
Okay. All right. Thank you for your help.
You're welcome. Is there anything else I can help you with today?
No, you already did. Thank you so much for your help.
All right, thank you. Have a good day.
Same to you. Bye-bye. Alright, so under the BenefitsCal.com, when you actually go to the homepage, under program, you will see different options, which is the first one is the food, CalFresh, Cash 8, health coverage, Medi-Cal, and other program. So technically, I am on the website or the first options right now for the CalFresh. So CalFresh details. This is actually they have a different other programs too. So let's learn about the CalFresh first. So is CalFresh right for family? CalFresh can help your family get access to healthy food. You can use CalFresh benefits at most grocery store and even farmer markets to buy items such as bread, nuts, rice, and more. Who is eligible for CalFresh? CalFresh is open to family who are U.S. citizens and legal residents. It's also open to people with a qualified immigration status. People 60 plus and disabled may have a higher income and still qualify. What documents will I need? These documents may be helpful when you apply. Identify applicants. Birth certificate, driver license, paycheck, voter registration card, school records, U.S. passport, social security number, social security card, proof of applications if no social security exists, immigration status. All documents and forms must be verified through the Systematic Alien Verification for Entitlement (SAVE). Verifications of immigration status shall only be required for those non-citizen household members who are applying for CalFresh. The I-6 AA is not acceptable verification documents. The I-94 is acceptable depending on what type of information is provided on the form and if USCIS approve of such information. Resident, driver license, check stub, rent or mortgage receipt, utility bill, money you earn, date check stubs for last 30 days, statement of your employer, copy of last year tax return, vehicle registrations, Department of Motor Vehicle Registration certificates, other income, a current beneficial check, copies of child support checks, alimony checks, award letters, statement from college financial aid office, resources, bank statements showing saving and checking accounts, resources, mortgage statements, life insurance policy, statement of stocks, bonds, and certificates on deposit, CDs, housing and auto bills, mortgage and rent receipts, lease or statement from your landlord, property tax statements, utility bills, Medi-Cal bills, only needed for household members who are age 60 years old or older or permanently disabled, billing statement, itemized receipt, child care receipts, which include amount, day pay, and name of person care was for signature of provider and date. So that is what is the Medi-Cal a little bit about. And also next one they have is, actually let me go back to this, the cash aid. So technically CalWorks detail is CalWorks right from my family. CalWorks help with cash to pay rent, housing, food, clothing, medical payments, and utility from family with at least one child in the home. There are other cash programs that you may qualify for, like General Assistance, General Relief, GAGR for single adults, Trafficking and Crimes Victim Assistance Program, TCVIP, Refugee Cash Assistance, RCA. When you apply for cash aid on BenefitsCal, you may be screened for these other programs based on your situations. Who is eligible for CalWorks? Families that have little cash on hand may qualify. It depends on citizenships, age, and income. We also consider your resources, access, and other factors. What documents will I need? These documents may be helpful when you apply: birth, citizenships, all that informations. Immigration status for non-citizen. Immigration's paper, forms, cards, copy of both sides, certificates of naturalizations, a confirmation receipt of letter from USCIS verify you fill a T or U visa application. It can also be a copy of the T or U visa application, a statement that you intend to file or take steps to become federal eligible. This document could include statements from people who are helping you, like law officer or victim advocates, letter or continuing present, other proof of immigrants USCIS such as work authorizations, letter of decisions or court order in your case, fee receive, notice of actions form I-797 approving a U visa or request for U visa interim relief, notes. All documents and forms will be verified through the Systematic Alien Verifications for Entitlement, SAVE. Proof that you live in California, money you earn, relationship, housing and utility costs, resources, other expenses, Medi-Cal expenses, Medi-Cal verifications, and immunizations records for shorts for kids under 6 years old. Yeah, so many actually programs that they offer here. Also, lastly is the health coverage, and we already talked about this. Who are eligible for Medi-Cal? So if your income is over Medi-Cal limits, you might still eligible for help paying for your private health care. You might qualify for health insurance even if you are not U.S. citizen or U.S. national. All right. And everything will be listed on BenefitsCal.com.